What's up, everyone? It's your host, Jonah. Welcome to the Blue Collar Enlightenment Show, where we learn new things every episode through conversations with guests from all around the globe. Hit that sub button so you can keep up with the journey.
Hey everybody, it's your co-host T. Today we welcome Dr. Mitchell Yass, author and creator of Yass Method for diagnosing and treating chronic pain. Dr. Mitchell has been featured on numerous TV stations along with growing YouTube following.
Thanks for coming on the podcast, Dr. Mitchell. How are you doing, man?
It is great to be with you this evening. Looking forward to spreading the gospel about how you could be pain-free and fully functional.
Awesome. We're ready. I'm excited for this one. Tell us and the listeners a little bit about yourself.
So to understand the method is really to understand how I personally cultivated it. It really came from my childhood when I was a very thin guy, had a lot of self-esteem issues, decided I was going to have to get stronger and make muscle mass. So I did everything I was told by Joe Weider and Arnold Schwarzenegger, and nothing took. And then finally at 26, I actually had remembered that I had taken a high school physics course and realized that weightlifting was kind of about physics because gravity is a force vector. So I started to apply the laws of physics, and over 4 years, I put 40 pounds of muscle on. At this time, I was a project manager in construction. That's what my degree was in, became disillusioned, didn't really feel there was value in it anymore, and I was looking for another profession, and I heard about this thing called physical therapy. So as I get into it, I'm taking the courses, and as you finally get to the end of that period, you're going to now be doing your affiliations where you're actually going to treat people. And in school, you're taught that the primary mechanism of diagnosing the cause of pain is the MRI, and whatever comes up on the MRI is the valid cause. So herniated disc, stenosis, arthritis, all the things people have been told are causing their pain was told that that's what I should treat. But being the person I was, I thought the most obvious question to ask somebody is, can you point to where your pain is? And so when they started pointing to their pain over and over and over again, it became evident that where they were pressing wasn't where the pain should be if that identified structural variation were to cause pain. So by definition, their pain couldn't be coming from that structural variation. So I decided to start interpreting their symptoms. And what I came to realize was that in more than 98% of cases of pain, the cause was muscular. And the beautiful thing was I had just taught myself the physics of weightlifting and was then able to use and implement that mechanism to resolve muscular deficits. And I was getting people better in a treatment, 2 treatments, instant resolution of pain and return to function. And so that became the path that I used, and it's 30 years later, and I've treated thousands of people, thousands scheduled for surgeries who ended up never needing it, and unfortunately treated thousands who got surgery that didn't do anything, and yet I still showed the muscular cause was there, present, and resolved their pain by my method. So that is a brief understanding of my path.
When was the moment you knew you had the correct path that you were going down?
So one of the other gifts I was given as a child was the ability to do analytical thinking, theorizing. I actually was taught how to create my own theory. And so this is hard for someone to imagine, but I was literally a student, and I was doing my last affiliation, and this is the first time I have people in front of me, and it just seemed time after time what I was told theoretically was the mechanism to diagnose the cause of pain in implementation. It just wasn't showing up. It just wasn't there. And I'll kind of give you a brief understanding. So imagine you're me, okay? So this person's in pain, and they say, oh, I have pain around my kneecap. And they present with an MRI saying they have a torn meniscus, and the torn meniscus is the cause of their pain. So because of my understanding of the knee, I recognized that the knee is comprised of 2 joints, one joint being between the thigh bone and lower leg bone. That's where the meniscus lies. And then the separate joint is the joint between the kneecap and the thigh bone. And that's where they're having their pain. But they're being told that a structure of another joint is the cause of their pain. Well, if you're willing to accept this premise, then you're willing to say that pain at your elbow is coming from arthritis of the ankle. And I'm pretty sure nobody in their right mind is going to accept that kind of crap. So I couldn't accept that the structure of one joint could cause pain at another joint. So it just kept happening over and over again that what I was being told was supposedly the tissue creating the symptom couldn't be based on the symptom presentation. And I was very fortunate I had this understanding of weightlifting and how to resolve muscular causes. So I was kind of open to attempting on my own to, when establishing what muscle was creating the pain, when it wasn't the structure, I could try to use the strength training technique. And I'm talking about almost every single time I would do the treatment, and the person would say, I either feel incredibly better or my symptom is resolved. And I mean, you have to understand how very disconcerting it is when you just went through an educational process and what you were taught is not presenting, and yet what you think it is and your ability to implement it on its own keeps coming over and over and over again. And you run into a moral dilemma. Once you graduate, now you say, do I do what I'm told, or do I do what I think innately and empirically seems to be true? And I just, in all good conscience, had to do that. And so I just started following this process of interpreting symptoms, seeing the cause is muscular, doing a little massage, some strengthening, and getting people better. And I said, I could never step away from this. I'm going to continue to pursue this. I'm going to try to evolve it, make it more and more accurate, and just continue to see where it takes me. And I just knew from that point forward, that was 30 years ago, that I was on the right track.
And your method doesn't use any kind of opioid. You don't prescribe pain medication, do you?
So I'm kind of the antichrist to the opioid population. So remember this concept that opioids mask the brain's ability to interpret pain. It doesn't take away pain. Pain is being elicited by a tissue, and a pain receptor at that tissue is sending a signal to the brain. The opioid blocks or attempts to block the awareness of the brain's recognition of that pain signal. So it's doing nothing to resolve the cause of pain, right? So I think that's insanity, because ultimately, if all you want to do is try to minimize your awareness of pain, you're just allowing pain to be consistently initiated by a tissue in distress indefinitely. I don't think that's very fair to do to somebody. So my method looks to interpret through a diagnostic mechanism. Make sure we understand this. This is not just a treatment. When you come through, the first part of a session with me is understanding what tissue is in distress. And what I found, as I said, was 98% of cases, the cause of pain is muscular. Now, by the way, it's not to say that I don't think there are structural causes or that surgery isn't necessary, but it can only be when the symptoms indicate that structure is the cause. And I would endorse the use of surgery when that's the cause. But that's, again, I've shown in less than 2% of cases. So 100%. And it must be clear that I'm not saying that there isn't a certain need for opioids as an acute component. Nobody should be left to suffer in pain until their cause is ultimately resolved. If there's some period of time where the cause has to take time to resolve, certainly some mechanism for diminishing the experience of pain is obviously legitimate, but it should always be done with the understanding that simultaneously you are resolving the cause. So at one point, the tissue in distress no longer is in distress, thereby no longer needing to initiate the experience of pain. So I want to be clear about all those things.
Yeah, right, because it's caused a problem of, the opioid crisis that we go through today, of people being so addicted to them and just munching on them like candy. The when we talked before, we were talking about there's more side effects than there are benefits to it, and I believe that wholeheartedly. Like you said, it just blocks the pain; it doesn't take care of it.
Well, but first off, in 30 years of actually treating people with many of them on opioids, I have never found one that said it fully prevents them from experiencing pain. I have always been told it minimizes it just enough that they could attempt to be coherent and experience their daily activities. But the side effect of the opioid, which let's be clear is synthetic heroin, is loopiness, lack of awareness, lack of focus. So you're basically maybe minimizing a little pain for your inability to be coherent and actually function properly. I don't see that as an equivalent alternative. I think that's insanity. It shouldn't be one of you shouldn't have to suffer with pain or be incoherent. Resolve the cause and the need for any of this nonsense and live your life.
Yeah, and the long-term effects of these medicines can be, tooth loss, rapid tooth loss, decay in your bones. I mean, it's like you said when we talked before, it's poison. You're poisoning your body. And the long-term effects of these opioids, I've seen it in some people, and it's not good.
All you have to do is look at the pictures of the heroin addicts in San Francisco living on the street, how thin, decayed, and unhealthy they are. Let's not be confusing. I don't care if you're talking about a prescribed heroin or street heroin. It's freaking heroin, man. There ain't no confusion about this. Let's not be confused.
Yeah, and they were giving heroin back, in the 1920s? They were giving that out as pharmaceutical aids.
Well, Coca-Cola, man.
Oh,
Coca-Cola was cocaine.
That's crazy.
So, what type of treatments do you give your patients?
So, again, the premise here is that we do every person that I treat, and I treat people both in person or through Zoom. The goal is to interpret what tissue is in distress, creating the very symptoms they're experiencing. And if, in fact, they're having a muscular cause, then we're going to do progressive resistance exercises, which are developed based through my understanding of physics. There was no curriculum that I've used to understand how I do my strength training. So if we could go back to this premise of this person with the knee pain. So if they went through the medical system, went to a physical therapist or orthopedist or anything, they're going to be treated for that meniscal tear. They'll do some sort of nonsensical conservative stuff. It's not going to work because it's not the meniscus creating pain. Ultimately, they're going to get surgery. They're still going to have the same pain because most likely it was muscular. And they're going to go on and on. They'll probably get a knee replacement. And that won't work because it's still muscular. And finally, as you said, they'll then be referred to pain management. And you now take medication for the rest of your life. You can't fully weight bear, and you basically have no quality of life. If you came for a Yass method evaluation, you would have found that that pain around your kneecap most likely is the fact that your quadricep muscle, the front thigh muscle, which attaches to the kneecap, is too strong in relationship to the posterior thigh muscle, the hamstring, the muscle in the back of the leg. And because the back of the leg muscle is weak, it doesn't oppose the strength of the quad, and so the quad shortens. When the quad shortens, it pulls up excessively on its attachment to the kneecap, so it compresses the kneecap into the joint. So when you're bending your knee, you would end up compressing it, and it's going to be painful. If you try to kneel on it, it's going to be painful. Go upstairs, downstairs, it's going to be painful. Trying to kneel down to the floor, it's going to be painful, right? So if we establish that through your presentation of symptoms, we would see your quad is stronger than your hamstring. There's lesser flexibility of your quad. I can look at you probably have an excessive arching in your lower back because a shortened quad would pull the pelvis down in the front, causing arching. So all these things would present. The solution is clear. Stretch the quad and strengthen the hamstring and the butt muscle. And so if you went for physical therapy, because of who they are, they would say, oh, if I stretch the quad, if I strengthen the quad, I strengthen the hamstring. If I strengthen my bicep, because that's what they're taught. But if one muscle is stronger than another, strengthening them both sustains the imbalance and you sustain your pain. So you would have to know which muscles have to be strengthened, again, through this understanding of the symptoms. So I would find the exact exercise to strengthen the hamstring and the butt, and I would cause those two muscles to get stronger and stronger by increasing the resistance that they adapt to until their force output is greater than or equal to the quad. That would stop the quad from shortening, pulling excessively on the kneecap, and you would have pain-free full function. So that's the type of exercise we would do.
And you got your start at a hockey team, right? You got into a hockey team, and that's where you really brought your practiced your theories, right?
So the last affiliation I had was with the guy who was the physical therapist for the New York Islanders hockey team, the professional Islanders hockey team. And the thing was, he was always with the Islanders. That's what he did. So he had this patient population of non-hockey players, and it was a very thriving practice. And I swear this is true. I walked in, he hired me as a student because he liked I was 32 years old. I was weightlifting. He liked my persona. So he hired me 2 weeks into an 8-week affiliation. So I graduate day one. I'm a physical therapist. And I walk in and I say, okay, what am I supposed to do? I mean, it's a first day on a new job. You think you're going to, and they're like, whatever you think. And I'm like, what? They're like, Steve's not around. He focuses with the Islanders. This population needs you. We're administrative people. You got to do what you think is right. And I'm saying, you're telling me I can do whatever I want. Nothing bad is going to happen to me. I'm not going to get fired. And they're like, listen, we don't know what to tell you. You got to start. Do it. So I had, within my affiliation, had these theories. So I was like, you're telling me I can do this, no problem? Okay. So I'm going to start looking at posture. I'm going to start evaluating people. And I just saw it as muscular, and I continued that process. And I was with Steve for about 1.5 years. And over that period of time, just imagine next door is the orthopedist who's referring these people with these diagnoses, herniated disc, stenosis, arthritis. And I'm saying, that's not it. You can imagine how insane, how very concerning it was to me, a graduate figuring out that something is wrong. And I came to the realization that what I did was, if someone had that knee pain and they were diagnosed with a meniscal tear and I fixed them, they would say, so you were saying that it wasn't the meniscus? And I just said, well, is it really important? Because we did resolve your pain and that's all you really cared about. And that's how I got away with not actually saying that it wasn't the structure. I actually figured out a way to manipulate how I discuss things so I can still get people better without jeopardizing my job.
How pivotal was that for your path through your career?
Oh, it was huge. It was huge. If I was forced to just do ultrasound and electric stimulation and never got a chance to experience, that's why I truly believe, and I talked to you about this when we first talked, I think I'm being used by a higher power, because you look at my entire path, there are so many factors that could never have gone into alignment unless they were meant to go in alignment. And the freedom initially to do whatever I want with no oversight, I think was critical. After I left him about 1.5 years later is when I opened my own facility. And that's when everything went completely wild and I was allowed to do whatever I wanted. But I think it was huge that I started off with that freedom to experiment.
So what do your colleagues say about what you're doing?
So because you're me in this situation, you don't have a lot of contact with colleagues. They kind of do their thing. So I'm in Jacksonville, Florida, and the Mayo Clinic is here. That's supposedly one of the most fancy facilities. And they have certain types of physical therapy organizations here. And you have to understand that if you don't know me, you don't know there's an outside to the existing system, right? It's the medical establishment. Physical therapy, orthopedist, neurologist, the MRI is the way we go. And so you just go through the process. And if they're willing to stay with that education, then they're going to just do the same stuff. And if nobody gets better, then I don't think they really care, because everybody gets that same education, that curriculum. I have to admit, it's a little bizarre for an individual to get that full curriculum and say, you know what, it's just not right. And more importantly, I think I could figure what's right. For most other people, it's I'm going to do what I was educated to do, and I'm just going to follow it. And if people get better, good. If people don't get better, so be it. And I feel like that's kind of where most people are.
So, what do you tell the people who say you're wrong by going in the opposite direction of the mainstream medicine? Because your ways of doing it are actually from the past, correct?
That is 100% correct. So, prior to the so chronic pain began in the mid 1980s. It had never existed prior. This idea of widespread global people experiencing pain from the teens all the way to the 90s. And as far as I'm concerned, I needed to understand that. And what I came to recognize is that the advent of technology, such as computers, phones, automation, led to less activity being done manually. The number one job in the world now is IT. It's a job where you sit. And so as a result of that, people just simply use their muscles less, which make them more susceptible to straining and eliciting pain. And that's why you could see this advent of chronic pain through all ages, from teens to the 90s. Well, one of the technologies that was implemented during this time was the MRI. And that's where we went to this concept of it becoming the gold standard. Any structural variation identified becomes the diagnosis, and that's all that is used. And the idea of interpreting symptoms went away. But if this was the 1960s, 1970s, or any time earlier, there wasn't diagnostic testing. So you went to your doctor and they would touch you and talk to you and test you, and they would do all the things that were done to interpret the body's presentation of symptoms to understand what tissue was in distress. This premise of getting a history of the symptom and then doing physical evaluations was created by Hippocrates himself. The Hippocratic method of treating is to do a thorough history and then follow up with evaluation, physical evaluation. So what I do is basically what had been done from the 1970s back to the period of the Greeks. So I take comfort in that. I know. So there's theoretical understanding, clinical understanding, and scientific understanding. I can show you in all of those cases that what I'm saying is 100% correct. Everything that is being done in the existing concept of diagnosing is 100% baseless.
So, what type of things have you built on from their research?
In terms of built on in terms of how I do what I do, or
Yes, your own method.
So if what basically happened is I'm sensing that something's not right in the diagnostic model of using MRIs. And if you have any sense of conscience, you got to be very hesitant to want to come out and say that what's being done is different and that what you're doing is unique. It's you really want to be tentative about saying that you do something unique. So what basically happened was, if you go back to this concept of what would happen, look at how the MRI is used. Let's say you have back pain. You go to the doctor, he takes an MRI, and the MRI finds a herniated disc. So because for the first time while you're having pain, a herniated disc is identified, it is asserted to be the cause of the pain. Because I have a scientific background, I understand that that's what is known as correlative theory or junk science. It simply says that if something happens when something else happens, the first thing can be the cause of that. The example of that is if I open my front door when the sun rises, I can say opening my front door causes the sun to rise. And I can have you stand at my front door for the next 6 months with me, and I'll open my front door, and right at the door, you'll see the sunrise. And I could say, see, I just made the sunrise. And you're going to say, wow, he appears to have made the sunrise. He did it 6 months ago, right? But you say, well, that's obviously nuts. They're just independent issues happening at the same time. And so the first thing I said to myself was, well, I know for sure that that's all that means, so it doesn't necessarily mean causation. Then I started thinking to myself, well, wait a second. You have lower back pain, and the MRI would show you have two elbows. I'm sure you have two elbows at the time of your pain. So based on that theory, I could say having two elbows is the cause of your pain. My God, you need elbowectomies because you have two elbows at the time of your pain, right? Insane, but the same exact theory. Then I went on and I said, well, wait a second. If having pain is caused by herniated discs, what should we find in people who don't have pain? No herniated discs. That's how the system has to work. Oh, well, by 1994, the first study showed that 70% of the population that does not have lower back pain have herniated discs. Well, everything I just said, by definition, means theoretically that the use of the MRI is baseless. Baseless. It doesn't meet the scientific requirements of theory and the hypothesis and non-hypothesis. All of these concepts, it doesn't match. So I had that going for me, and then that thing that I told you about where I started seeing that the symptoms don't match where they should be. And then I would actually say, touch on a muscle, and they would say, yes, the guy just left here before. And he had a pain that was running from the back of his shoulder, shooting around his shoulder to the front of his shoulder. I happen to know that's a referral pattern for a muscle in the rotator cuff called the infraspinatus. I pressed on his infraspinatus and he said, oh my God, yeah, that's it. If I bring on your symptom, doesn't that mean I know what's causing the symptom? It should make sense to anybody. If I can make your symptom, I know what's creating the symptom. So I just massaged out his infraspinatus and the symptom went away. So you could kind of see that everything I'm saying, everybody always says, wow, that makes sense. Wow, that makes sense. Of course it makes sense because it's based on logic. Logic will always make sense. That's the nature of logic. It's always right.
And you said something about the first time we talked, you said something about unevolutionary diseases. Can you explain that and what those diseases would be?
Sure. So I didn't say this. Actually, a documentary on the Discovery Channel talked about the fact that forever, through the history of mankind, man's evolution evolved around the concept of survival of the fittest. So the whole idea was that the person who could succeed most successfully, whatever within their genes, would go on. And the things that wouldn't help would go away. And that's how our genetic code constantly was evolving. And it's been like that forever. So remember we talked about the advent of technology and automation. Well, now machines can kill other men, right? I don't have to physically kill you. I can use machines, and I don't have to go out and hunt for food. I can go to my local restaurant or supermarket. And so as a result of the concept of automation and technology, the idea of survival of the fittest has been shown to have just basically resolved. There is no more concept of survival of the fittest. So as a result of this concept, certain diagnoses, diseases have developed because of this no longer evolving of man's body. And those are type 2 diabetes, obesity, and cardiovascular disease. Now, I can actually show you in another show that they had, there are these people, and I believe it's in the Southwest, like New Mexico or Arizona, and they're called, what are they called? Plateau runners, I think is what they're called. And basically, this is a indigenous people who live off of deep plateaus. They live at top of it, and basically they have a very remedial type of lifestyle. They hunt and they fish and they live in mud huts and things like that. And so they were in amazing shape. They were fantastic. Well, it turns out at the bottom of the plateau, that's where society developed, urban and rural society. And some of these people decided to move down into the urban society, the way that cities work and stuff like that. And they had fast foods and they worked on basic jobs and had computers. And literally these people, every single one of them, developed cardiovascular disease, obesity, and type 2 diabetes. And all the people who were still on the top of the cliff Nothing happened to them. And you have to recognize that from a genetic standpoint, they're all the same. So the realization came that those diseases are environmentally based, not evolutionarily based. They're
Right.
not genetic.
You can see it in the Native American population.
Sure.
What society has done to them.
Sure.
You know, the addiction of alcohol, obesity, gambling. I mean, yeah, you can see it within a lot of the populations. And if you go over to, you know, say Africa, where those tribes still exist, those people are in the best shape. They could outwork and outdo, 90% of America's population.
Absolutely. There's no question. You can look at Asian cultures, China, Japan. Once Kentucky Fried Chicken, McDonald's came to these places, the obesity rate skyrocketed. All those diseases, those three primary diseases, have now blown up. It's incredible.
Yeah, it's definitely mind-blowing. So do you think big pharma, having pockets in the mainstream media and having such a stronghold on most medicine, do you feel like the work that you do and the message that you bring kind of gets it's harder to get your voice out and be heard?
There's no question.
All the noise.
There's no question. So I actually treat this doctor, and he sees it both ways. So my whole premise was that because of the fact that the system for medical treatment is fee for service, which is to say that they get paid for providing a service that is not based on outcome. Say, for instance, if you go to a restaurant, if a guy charged your steak, right, you wanted it done rare, you're not going to pay for that. Right? If you go to a mechanic and you turn the car and he says it's fixed and the car doesn't go on, you don't pay for that guy, right? But if you have back pain and you get a 5-level fusion for $500,000 and you still have more pain, the same if not greater pain, he gets paid, right? So with that understanding of that fee basis, it's hard to understand why anyone would want to change that. So I've always promoted that that's the key. His promotion, which I thought was quite interesting, is that these guys are indoctrinated into an educational system that says this is the way it is. You are not allowed to deviate or we will take your license away. So they're unfortunately kind of, this is what they're told to do. They have to do it, and this is how they get paid. So it's very hard for anyone to deviate. The other point about that I would make with pharmaceuticals is the fact that in 1999, the Stark Law was created. The Stark Law allowed pharmaceuticals to direct market people. It had never been like that before. Before that, it was always that pharmaceutical rep had to go to the doctor and try to manipulate them into using the pharmaceuticals, right? Forget that crap now. I'm just going to pound you day after day, every second and third commercial with how great my pharmaceuticals are, right? And what has it done? It's created a population where everybody, you could look at it in children, right? Every kid's got ADD and every kid should be on Ritalin.
Yeah.
Well, maybe the kid's just a really happy, excited kid. I mean, why do you got to give him that title and why do you got to give him the drug? And so that's the society that we live in. So clearly there has been a cultural acceptance that the medical system and pharmaceuticals have the answer for your health. And my promotion to everybody is 4 pinnacles of health of what you need to think about. Exercise, diet, sleep, stress reduction. Every one of those is within your capacity. You control your health. They address your disease once disease is entered, but they can't stop disease from entering. Only you can do that.
Right. And 2 of those go together with exercise and stress relief because a lot of people use exercise as stress relief.
I agree 100%. I'd be the first to acknowledge I think it's great for stress release.
Right. And I got to start working out again. But I have a very physically demanding job. And by the time I get home, I don't want to go lift weights at all.
Yeah. And so to be very clear, I think that's a very, very common mindset that people have for those that do physical work. And my only point would be that and the great part about the Yass method strength training is that you should never work out more than 2 or 3 times a week, number one. If you learn how to exercise through the Yass method, you recognize you need to do fewer exercises, fewer sets, fewer reps to achieve the goal of strength training. My point would be that if you were to take the time and devote 2 more hours a week for strength training, I bet you the quality of your work time would be enhanced immeasurably. It would be easier, more efficient to do your work, and you'd have less chance of being in pain or having any symptom associated with it. So it's a give and take, but I think once you would get there, you would see the value. It's just overwhelming.
So what, in your opinion, what's the future of your treatments and research look like?
So right now, I recently had opened a facility in Jacksonville, Florida, where I live. And we opened it in June, and we're starting to grow there. I will forever provide information. I have a YouTube channel with like 280 visits on it. I've written 3 books. I've done a PBS special. I write articles. I believe, and we talked about this before, that we need a people's revolution. I think that there is not anyone in the medical system that is going to say, you know what, let's stop the surgeries, let's stop the MRIs, let's stop the medication, let's all just exercise. I don't see that happening. And I think that the failure rate for the medical system globally is so extreme that more and more people are simply out on the internet Googling, looking for answers. I just recently did a Zoom session with a lady in Wales. And I always hear the same story. She's dissatisfied with the treatment she's got. In fact, it's the same story. Nobody has asked her about her situation. They're simply doing treatment. No one talks to her. No one tries to interpret her symptoms. And so my opinion is that there is a revolution occurring, and it might be slow and insidious, but I think all just causes find their way to success. And I think that there will eventually be a demand to overtake the existing system. And I think enough people at some point are going to realize that the chronic pain epidemic came from technology, and that either you're going to have to remain physically active in your life, or you're going to have to sustain a basic exercise program, and you could be pain-free and fully functional. So I will continue to do this, and I continue to think it's going to grow. And I do believe we are going to reach that point at which there will be that revolution.
What has been the most compelling case that you've actually fixed? And you said, this is where it works.
So I'll give you, to me, this is like the most recent biggest one. So this guy who had been in pain for 30 years, half his life, he had had 7 back surgeries. His pain was at the left leg, the side, the front, and the groin region of his thigh, and his upper leg region, okay? For 30 years, he was told that pain was referred from his back, which is why they kept doing these surgeries. He had become crippled, couldn't function whatsoever. Through word of mouth, he heard about me. Again, I need to explain to people how to interpret their symptoms. So he's telling me that he has been told that this pain is from his back. So his wife happened to be there. So I said to his wife, go around to his back, push on his spine. I want you to jam your finger in as hard as you can and try to draw on that symptom in his leg. Push. I'm giving you the right to hurt your husband. This is your chance. Kill him. Push, push, push. And she couldn't bring it on. So then I said, okay, now stand in front of him, and I want you to take your thumb and jam it into his front thigh and see if you can bring it on. I'm telling you, I'm authorizing you. Hurt your husband. This is great. This is your chance. She presses. He goes through the roof. I said, okay, so let's think about what just happened. In less than 3 minutes, I just showed you that it was impossible for that pain to be coming from your back because they said it was referred. And if it's referred, it means that the point which they're saying the pain is coming from, that's where you have to press to bring it on. And you couldn't bring it on. But when you pressed on your leg, you brought it on, which tells you that's point tender pain, which means the tissue you're pressing on is the tissue that's creating that pain. So they were stunned with that understanding. So I said, okay, well, now that we know it's just your leg muscles, let's do a few exercises. Did 4 exercises. By the end of that, where he was limping, he wasn't limping, his pain was greatly reduced. A couple of days later, do another session with him. Now he's walking, and now for the first time, he's like, man, there's something to this. And it was fascinating because he said, I'm telling you now, I know you want me to believe it's my leg. I don't care if it's my leg. I don't care if it's my back. I don't care if it's my head. All I know is I'm starting to walk and out of pain. That's all I care about. So then about 4 to 5 weeks go by and I don't hear from the guy. And I'm like, oh my God, that's never a good sign. Something bad must have happened and he doesn't want me to know. So I email him and he writes back and he said, well, to tell you the truth, I understand how to do the exercises. I didn't think I really needed you any further. You explained how to progress the resistance. So I've been doing the exercises and I'm basically pain-free and I'm walking every other day, 3 to 5 miles.
That's awesome.
That is awesome.
Sick. Awesome? Yes. Perverse. This guy gave up half his life for some bullshit little diagnosis that for a guy like me was incredibly obvious and easy to fix. I don't want anyone to have to live that life. That's why I think I've been chosen. That's why I come on podcasts. That's why I write. That's why I will sing from the rooftops to let people know there is an alternative from the existing system. And all I'm asking you to do is not take it because I said so. Just look at it and see if it makes sense. And if you believe it makes sense, implement it.
So you have a book. Tell us a little bit about your book.
So I've actually written 3 books. And the first one was called Overpower Pain. That was written in 2008. And the whole intent there was that if you were going to accept this book, then you were going to have to accept that the cause of your pain was muscular. And what I did was I went joint by joint and showed you the most common muscular deficit and then showed you how to perform the exercises, how to resolve that particular deficit. Then in 2015, I did a PBS special and they wanted to have a unique book as part of the gift package. So if you pledged, you would get the book, and that's called that's called the Pain Cure RX. And the whole idea there was I went through the most common joints where people have pain: the neck, the mid back, lower back, hip region, shoulder and knee. And what I did was I tried to show you all the possible muscular causes, and I showed you the actual Yass method mechanisms to evaluate yourself and determine which of the muscular causes it is. And then from there, in understanding what the muscular causes are, do the exact exercises relating to that. In the beginning of that book, I provided all the documentation I had developed, not all, but a lot of it, regarding why the MRI is baseless and why you can't accept that structural variations are the cause just because they're identified at the time of your pain. So I began to give people backup. Now you could have the power to say to yourself, you know what? I know that doctor said that, but here's the evidence saying it's not right. So I'm going to now look and see if I could evaluate based on these presentation of symptoms, what the cause is. And if it's muscular, which I said it is in 98% of cases, I know what to do exercise-wise. My last book was the Yass Method for Pain-Free Movement in 2018. And there I wanted to take a different approach. People have problems sitting at a computer. People have problems driving a car. People have problems standing. So we went functionally. What is your functional limitation? What is that activity you can't do? And then explain what the common muscular deficits are that are impeding that and give you the exercises so that you can address the particular muscles associated with your particular dysfunction and then go on and allow you to become pain-free and fully functional. So each book has its own specific presentation, the idea of why you would want that particular book. So, and it's been a progression also in terms of my personal evolution. That's gone from 2008 to 2015 to 2018. So,
aside from your books, you said you do some writing on blogs. Is that what it is?
Yes. So, going way, way back, probably back till 2008. I've been a writer for the largest subscription newsletter in the United States called Bottom Line Health. They also now have their own website, Bottom Line Publications. And so once they opened the website, which was at least 7-8 years ago, I became one of their primary bloggers. And so I'll just give you you got to appreciate why would someone invest all this time and effort in the shadows? Why would someone do this? And it's because I think I was chosen to do this. And this is the kind of feedback I get. So I wrote an article on trigger finger, and everybody is told that it relates to the little ring of cartilage that holds the tendon in there, and you get injections and surgery. That's the medical system, right? But I basically came up with the understanding that any type of pain from the elbow to the hand is due to the fact that the hand is designed to grab objects and manipulate them, not support the weight of them. Supporting the weight of the arm and the object comes from the shoulder and shoulder blade. So if you have pain in any of these muscles, it's because you're squeezing too hard to support, because you actually have shoulder and shoulder blade weakness. So the resolution of trigger finger, carpal tunnel syndrome, golfer's elbow, tennis elbow, all comes to the strengthening of the shoulder and shoulder blade musculature. And again, there has to be the presentation of symptoms to confirm that. So I get to do a Zoom session with a lady, and I'm treating her for something. And all of a sudden, a guy puts his face in, and he says, "Hi, I just want to let you know I'm so-and-so, and I told my wife to get treated by you. I just wanted to let you know that I am a professional pianist, a concert pianist, and I had trigger finger, and I got cortisone shots. It didn't work. I was told I needed surgery. I found that article you wrote in Bottom Line Health, did the exercises, and resolved my pain fully. And I just wanted to come on to thank you and tell you you saved my life." You couldn't pay me $1 gazillion for the feeling that I get when something like that happens. I didn't know that guy from Adam, and yet somehow, through the will of some higher power, he found that article when he needed it, or he wasn't going to be able to have his profession as a concert pianist, and he used it and resolved it. I didn't get a dime for that. I don't need a dime for that. All I need to know is that that message is out there and it's helping people, and it justifies why I continue to do what I do. And that's the kind of feedback that I get and I love.
The vindication of having you being right has got to be the best feeling ever.
It's the greatest thing in the world, man. And it's so I found enlightenment, and we talked about this last time we talked. So about 4 years ago, I found enlightenment, and I live in peace. I live for the moment. One of the most important things that changes was that when you talk about vindication, before it was all about propping up my ego and telling people to kiss my ring and I'm the greatest thing in the world and you should give me gazillions of dollars. Well, after enlightenment, it has nothing to do with that. This is not about me. I am a servant to a higher power and nothing more than a conduit between the information I was given and the information I can give to people. And when that happens, it's always the same thing. When that guy says that to me, in my chest, I am feeling the concept of thank you for giving me this gift, and thank you for giving me the gift, the ability to give that gift to that individual. The vindication is in the fact that I'm being used for a higher power, and that I should continue to do it fully and embrace it and don't question it. And that's what the enlightenment did for me. I don't question it anymore. I am more at peace now in my life than I ever have been. And people can think I'm nuts. People can think whatever they want. It doesn't matter. I will continue to do this. By the way, over 30 years, I've treated over about 15,000 people with probably a 90-something, 95, 96% success rate. So I think I got enough evidence to say I'm right and I should continue doing it, regardless of what anyone says to me.
Absolutely.
Well, I think that's the first time I haven't had to ask what has been the most enlightening moment of your career. Oh, you already got it out of the way. Well, that's actually the last question, so that actually came up a good time because we got a scoot, we got a party to go to for friends. But I got one more question. Where can everybody find you?
So I tell everybody this is important to understand. Never hesitate to email me. People, if you Google me, I look like I've got this massive presence and there's this massive organization. I'm just a guy, man. I'm one guy. And any email that's sent to Dr. Mitch at MitchellYass.com is my personal email, and I will answer every email. There is nobody who lives in pain that shouldn't have the right to be out of it. So I think it's my moral and ethical obligation to respond to everybody and help them to understand the right path to go on. So Dr. Mitch at MitchellYass.com. You could go to my website, Live Without Pains, plural, livewithoutpains.com. And there's a lot of information there. If you want to schedule a Zoom session or an in-person session, you could do it on the website. There's also a contact us button that you could contact me and I'll get that email. In terms of just getting information, YouTube, man, I think that's it. Just go on YouTube, search Dr. Mitchell Yass. It's got to be 280 videos on there now, and they're all applicable videos. This isn't the goal of just giving you a lot of pie in the sky crap and saying, oh, believe it. I want to give you information that helps you understand how you can personally resolve your symptoms. So I think that's a great location to get information. Facebook is at the Yass Method. But I think those are the important things to know about.
Amazing. And it's a great message. I'm going to have to get a hold of you about some of my pain, see what you can do about it.
I would actually love that, and then have you come back on. We do less than a month's period of time. I'll do a session. You followed up on those exercises 3 times a week for 3 to 4 weeks. We'll come back on, and you could say how you personally were experienced, how you had the experience of the Yass Method. I think that would be awesome.
That sounds like a great idea. Great idea. And I thank you so much for coming on the podcast, spreading your message, giving us this info, and you're always welcome back on. And like I say, we'll keep in touch, and I'll go through a couple sessions with you, and we'll talk about it again.
I love it, man. I appreciate it. Thank you. Appreciate being on the podcast.
All right, that's all the time we have for today. You can now find us on our new website, thebceshow.com. Go check it out where you can contact us and subscribe. But remember to give us a rate and review. It helps us with that pesky algorithm. Thanks for listening.